All right, so welcome everyone. This is the Wayne County Health Catalyst for COVID Care Health Literacy Training presentation. Thanks for joining. For those of us who have joined, we'll give everyone a few minutes to get joined. In the meantime, we'll do intros and stuff in just a few minutes, but what we'd like to start with is our pre-session survey. This is an evaluation to see how we can improve and better teach you. So if you have a chance, we would greatly appreciate if you could go ahead and either scan this QR code or the link is in the chat box. Thank you, Maya, for putting that in there. So I'm going to mute and we'll give everyone about 3 to 5 minutes to get this completed. Appreciate your participation. Okay, everyone, we'll go ahead and get started. If you're finishing up the pre-survey, that's fine. We'll start with introductions. So thanks for joining us again today for this health literacy training. Again, I'm Dr. Carolyn Custer. I'm the project director of the health literacy training portion of this grant, which is being done with Wayne County and several partners. And so I put together this information in partnership with a team of people at Wayne County and our other partners. I'll let Ms. Maya Campbell introduce herself.
Thank you so much. My name is Maya Campbell. I am a very proud CHW or community health worker. I'm very proud to be a part of the team at MISHWA or the Michigan Community Health Worker Alliance. And thank you again, everyone, for attending the training today.
Thanks, Maya. Okay, so our agenda for today, we're going to do an overview of what health literacy is. We'll talk about 5 health literacy interventions specifically. We'll take a short break, probably more like 5 minutes. And then when we return, we'll talk specifically about a few strategies to overcome vaccine hesitancy and end with an interactive case discussion if we have time. Sorry, my slides. Learning objectives. By the end of this session, we hope that you can describe health literacy as a determinant of health and become familiar with some strategies to address and improve health literacy. These specifically, we'll talk about class, culturally and linguistically appropriate services, reflecting on strategies for cultural competent care, and again, looking at vaccine hesitancy. Before we get started, Maya and I want to let you know and encourage you that this is an interactive presentation. There will be some slides where we are going to ask you to come off mute and participate. We love participation, but we understand if you're not able to, that's fine. Also, if you'd like to put things in the chat box, Maya will monitor that and we can, get questions that way. Okay, so let's get started. So we're going to start our discussion of health literacy with health equity. It's impossible to talk about one without the other. For those of you on the call, who recognizes this picture? Does anyone recognize this? Yeah. So this is our traditional model when we talk about the difference between equality and equity, right? So equality, everyone's getting the same box despite their height. And you can see sometimes it works out. It doesn't necessarily work out other times. Equity, we're giving people what they need to succeed, right? Not the same, but we're going to take it one step further today. And we're going to talk a little bit about social justice and justice in general. Right. So we know that there's systemic problems, right, in our systems, healthcare systems specifically. And we've talked a lot about equity. But what if we start talking about justice and removing those barriers in the first place, right? So what can we do to remove the cause of the inequity in the first place? So throughout this presentation, we'll talk about, new system design and ways to be more equitable in improving health literacy and health in general. Social determinants of health, you all are aware of the different conditions that impact health that aren't necessarily what we treat in the office, right? So these are the places, people and things. It's all about location and environment. So we may be able to treat you in the clinic for a few minutes and give you our advice, but what does your environment look like outside of the clinic, and what things may impact health related to these types of things? So, the environment that you're in, the resources that you have access to, etc. So health literacy is part of this. All right, I'm going to turn it over to Maya.
Okay, thank you. So what is health literacy? So the CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or opportunity to achieve optimal health that is experienced by a socially disadvantaged population. And these things do exist because of health inequalities and factors like the social determinants of health and systems that are designed with structural racism. All right. So health literacy in Wayne County. So I'm sure that most, if not everyone on the call, is familiar with the term redlining. So traditionally what redlining is or was specific communities or populations being intentionally cut off from resources, such as healthcare, access to hospitals, and education. But unfortunately, Wayne County does have a history of redlining. This is a map of Wayne County, and it does kind of explain how some of the communities were strategically cut off from specific resources. All right, so what does health literacy mean? So does anyone want to come off mute and share their definition of health literacy? We know what literacy is, and we're pretty versed on what health is, but what are those two together? What does that mean?
Having a good understanding of health.
Absolutely, absolutely. So is it just the responsibility or the burden of the patient, client, or consumer to have a good understanding of health literacy?
No, I guess not.
Okay. So Dr. Custer, do you want to talk about Healthy People 2030? And we'll get back to that in just a second. So thank you for your answer. I'm just going to put a little pin on that, and then we'll chat about it very briefly.
Is it Quenisha? I want to make sure we're saying your name. Okay.
Yep, that's correct.
Okay. Nice to meet you.
Nice to meet you as well.
Thank you. Thanks, Maya. So yeah, so you're right on it with your answer, Quenisha. So, Healthy People 2030 are guidelines for the nation's health, and they come out every 10 years. And, historically, the definition or the goal rather to improve health literacy has been defined like this. Personal health literacy is the degree which individuals have the ability to find, understand, and use information, right? So lots of different things that we have to think about with our healthcare system in the United States. However, in 2030, what they did was they added organizational health literacy as a goal, which is very important. We work in these healthcare organizations, and we need to make sure that as providers, we're making sure that we're equitably enabling people to have health literacy, to improve it, to understand what information they're receiving. So we're going to talk a lot today about personal health literacy, but also organizational. Back to you, Maya.
Thank you so much. We work so well together. Okay, so health literacy components. These are the skills and knowledge needed to interpret health information. So if we break it down further, so literacy is quite literally reading, writing, basic math, speech, and comprehension skills. Numeracy is the understanding of math and how those numbers are used in the real world. And factors that impact health literacy. The complexity of the health information. Is the information difficult for the patient or patient or client to understand? Language, the age, state of health while they're the patient or I always say patient, I'm sorry, so forgive me. I know it's kind of interchangeable. Some say patient, client, member. So patient, are they anxious or nervous during the appointment? Their cultural background, and the way that the health information is communicated by the provider. These are all factors that impact health literacy. All right, so as we discussed, there are individual factors like literacy skills, health knowledge, demographics, culture, experience. And then there are system or professional factors like the public health practice, public health infrastructure, public health workforce, and all of these these factors all put together make up health literacy. All right.
All right, so some of the impacts of limited health literacy. On an individual basis, members with limited health literacy rather are less likely to use preventive health services. That kind of makes sense, right? If you're not aware, things like pap smears, mammograms, the things that we do to stay healthy. Less likely to effectively manage chronic disease. Again, you need to have some basic understanding about health. More likely to have poor medication adherence, higher rates of hospitalization and use of ER, higher mortality rates. And this is a big one we'll talk about during this lecture, report a sense of shame about their health literacy. And that can really, have an impact on how people even feel about approaching a provider, right, to ask questions. And these are all associated with higher healthcare costs and expenditures, which we have enough of in our country. So it's important that we do what we can to improve this. On a community level, just a few things that, may be an impact on a community level, things like all of the health fairs. We do so many great preventive screening, vaccine fairs, etc. Knowing about those, being prepared for emergencies, disasters, warnings about contaminated water or even food safety. So these are just some of the things that, on a community level could be impacted. So health literacy and literacy, as Maya mentioned, we know literacy, right? Literacy is the ability to read. The average reading level of adults in the United States is 8th, 9th grade. And most health education materials are written at 10th grade level or higher. So you can see there's a little bit of a problem there. So what they recommend is the best reading level for materials is 5th to 6th grade. And that way we can ensure that, materials are written in a language in a way that most people can understand. So we'll come back to this when we talk about materials more specifically. Red flag behaviors. So if you're with a member and you notice any of these red flags, or if you
Recording in progress.
so let's mute you. Okay. Perhaps, frequently missing appointments, incomplete or non-compliance with care generally. Incomplete registration forms may be a clue that there's an issue with writing. Medication, maybe not knowing about the medications, unable to give, a coherent history, lack of follow through. And the biggest one here really is asking fewer questions. So if you're going over a treatment plan or a course of action and and the person you're talking to is just nodding and they're not asking any questions, they're just, and then at the end you say, do you have any questions? They say, no. That's a person who may be having some impaired health literacy. So maybe they're not really understanding. So this is a red flag that we need to, take a look at and say, maybe we need to come back and look at this again with this member. Any questions about that? Okay. So we're going to talk about using a universal precautions approach. I know there's a lot of behavioral health people on the phone or on the call. I don't know if you had physical health experience, but one thing that we talk about with universal precautions is bloodborne pathogens. So, you can't tell if someone has HIV or hepatitis just by looking at them, right? So what we do in healthcare is we treat all blood and fluids as if they have a pathogen or HIV positive, right? And so we put gloves on if there's blood. We don't touch it with our bare hands. We take universal precautions to make sure that we don't get an infectious disease, right? So in the same way, you can't really assume what a person's level of health is just by health literacy, rather, just by looking at them, what their education is, even what their job is. It doesn't correlate. So the universal precautions approach kind of assumes that everyone has some limited understanding, and it really forces us to think about ways to communicate in a way to clarify and make it so everyone can understand, right? And just a aside real quick, this information for universal approach comes from the AHRQ Universal Toolkit. And that is one of the resources at the end of these slides. You will get a copy of the slides and there are links for everything. So if you want to look further into this, there's more information. So the goals of this really are to simplify communication, confirm comprehension, reduce the risk of misunderstanding, miscommunication, making our system easier, which is so important, and really supporting our patients' efforts to improve their health. Okay, so this slide shows what a health literate organization looks like. So this is kind of our goal. I'm not going to go through every spoke of the wheel, but to be a health literate organization, it has to be supported all the way from the top, right? The CEO down to the people that we're serving. And it considers, materials, communication, even considering bringing, your members in to evaluate and look at the practices in your office. So just some things to think about. All right, so that's kind of the end of the introduction. And I'm going to turn it over to Maya for our first interactive question.
Yes. So as we talked about, there's some parts in the training that we'll ask you guys to share. So would anyone like to share a time when having low health literacy impacted you or a loved one's ability to be healthy?
Has anyone
So
ever? Go ahead, Maya.
I'm sorry. I actually do have something to share here. I see Miss Anderson, you came off mute. You can go first.
I was just gonna say, just for myself, it had a slight impact of me not really understanding my coverage, what things were covered, or what doctors to see, or who was under my my what is it called, under my plan, so that it would be
Yeah.
covered. So until I actually found that out, that did kind of hinder me from receiving certain services that I may have needed but didn't really go forward. I was more so just getting my regular stuff, and then anything else I was just like, well, I didn't really understand or didn't know, so I didn't do it. So now that I have the knowledge and I'm able to understand things a little bit better, I can do more with my healthcare options.
Excellent.
And I find
Thank
the
you.
same thing. I'm sorry. I find the same thing with my my clients. They don't really know. And I'm like, hey, do you have the card? Just flip that card over, call that number. They'll, direct you, so I find myself, I've been saying that a lot lately. I'm trying to help people understand where they can get help and, if they do have health insurance.
Oh, that's great. Thank you so much for sharing that. I always say I love doing these trainings because we always hear different perspectives. And that is definitely a different perspective. And thank you again so much for sharing that. And that is very empowering just to know and understand your coverage, like you said, and what's help, like what's covered and, what treatment you can get under your insurance. So that's great. I did want to share just a quick personal thing. I have an older brother. I have a few older brothers. One of my older brothers in particular, unfortunately, was dealing with cancer. So it really scared my other brother. To the point that he said, I'm not going to the doctor. Every time I go to the doctor, I leave with bad news. So I talked to him about preventative care. We do have a history of cancer, unfortunately, in our family. And we started just talking about like our eating and our health. And my brother made a comment to say, no matter what, we're going to get cancer. It's just inevitable. And it was really sad and grim to think about that. But then we got deeper in the conversation, and we're very much an Afro-Caribbean family. So we started just talking about our diets, and it's like maybe it may not be so much genetic. It could have genetic factors, absolutely. But there may be other things going on, like the traditional way that we eat, where we put animal fats and all the vegetables and things like that, small things that we can swap out that could potentially change, the course of that. So just knowing and understanding, genetic factors versus environmental factors, I think is something that we don't think about, but it's important. It does impact our health literacy or in our overall health. So I did want to share that.
Thank you for sharing, Maya.
This is Ashley. I just wanted to share something personal as well. I know a few years ago, I found out that I was pregnant, and I ended up losing that pregnancy because I was unaware of a condition that I had no idea that I had, which was incompetent cervix. So I gave birth previously to 2 healthy children. I carried those children in turn, had a healthy pregnancy. And then a third pregnancy, I didn't know I was pregnant at the time, but when I found out, I ended up losing that pregnancy. and I didn't know about the incompetent cervix. I had never even heard of anything like that. And I knew my body was going through a change, but I just automatically just assumed it was a part of pregnancy. I felt a little different. And when I called my OB to let her know some change, some things I was feeling, they just chalked it up to, oh, that's just regular pregnancy feeling. You don't, this is just what goes on at this particular time. And so not having the full picture or having that understanding that there's or being checked for the incompetent cervix, or being able to advocate for myself that this is a condition that I just came up upon me, or was it something I already had that I just didn't know about. So that was something that I studied, I researched more, and I was able to carry the fourth pregnancy to term because of just doing my research and understanding my body, and just my ability to be healthy to carry the fourth pregnancy to term.
Thank you so much. And I'm sorry, that was Natasha?
That was Ashley. She's in
Ashley.
Natasha, I believe. Yeah.
Okay, Ashley, thank you so much for sharing that. I know that it's very deeply personal, and thank you for being vulnerable with us. Because those are certainly things that, as community worker, health workers, or whatever your role may be, it's important that that advocacy and for that the advocacy piece, that you're an advocate for yourself. We'll get into it later in the training, but as the patient, you are the expert on your situation. The doctor, of course, is the expert on the medical side, but you know your body. So thank you so much for sharing that.
Yes, thanks, Ashley. Okay. So we're going to turn it back over to Maya.
I'm sorry. I'm just so grateful and blown away by the sharing already. So this is a great training. So I'm so excited. So you guys will probably see me smiling the rest of the training. So health literacy interventions. So these are evidence-based interventions and strategies that can be used to increase the client or patient's health literacy levels. And they do help create a more health literate environment. So health strategy number 1 is clear communication. So greeting the patient warmly when they arrive to the office, using the patient's words. So we'll dive into that a little bit later, but that takes active listening. So listening to what the patient is saying and repeating those words back to them, showing graphics. So I'm very much a visual learner. So graphics are so very impactful to me, making eye contact. So depending on the culture of the clients or the patients, making eye contact is a great way to show that you're listening and you care. Slowing down. And listening and communicating clearly, demonstrate how things are done, listening carefully, limit and repeat content, invite the patient's participation, use plain non-medical language. I know that can be difficult for some of us on the medical side. Not everyone's taking medical terminology, and we have to acknowledge that when we're working with our population served. Being specific and concrete, and encourage the patient or client to ask questions. Okay. All right, so I feel like I always take this slide over. So would you like me to just go ahead and do this one?
We're going to make this your slide moving forward.
Okay.
Okay.
Okay, so 7 things to consider when communicating about health. Trust. Will the person trust the information that you're providing? And who is the best source to put that information out? Sometimes the best source of that information is the community health worker. So not necessarily the provider or whoever the patient or member may have the trust with. And number 2, information. What information is necessary, and how will the person find it? How much is too much and how much is not enough? So information overload is a real thing. So we want to make sure that we're being very specific, but not giving too much information. So 3, motivation. How relevant is the information to the patient's motivation or the patient's goals? 4, environment. What are the conditions that surround and affect the audience? 5, the capacity. What is the person's ability to act on the information, and are there barriers? And number 6 is perception. What will the audience think about the information, and what will inspire them to act on it? And number 7 is response. How will people respond, and what can we do to stay engaged with them and give them support to take the actions needed? All right. So I'll pass it back to Dr. Custer.
Thanks. So using plain language, again, we just mentioned this, try to avoid medical jargon. I think we're going to say plain language 18 times throughout this series, but, things like modify, fracture, etc. One thing that's interesting is the word diet. If you ask someone, what is your diet? They might think Weight Watchers or Atkins or whatever diet, right? But what we're actually asking them is, what do you eat every day? So it's sometimes you just have to be clear and use the plain language and be very direct. So for example, your COVID test is positive. So we were doing a COVID screening fair at one point at I think it was a school-based, and we told someone that that their COVID test was positive, and they thought that was a good thing, right? Because positive is a good thing, generally speaking. And this was an indication that, we may have low health literacy. So we ended up changing how we were writing the results. We just wrote, you have COVID or you do not have COVID. And that's fine. We were very clear, very to the point, avoiding words that may be confusing. Okay, so plain language, using terminology that your member understands, communicating clearly and effectively, and really, empathy and greeting people warmly and all those things. That's all part of communication. And thank you, Maya, for presenting all that. We're going to move on to health literacy strategy 2, which I think you guys are going to enjoy. So using effective health education materials. We have so many materials, right? We use them all the time with our members. So just some general guidelines, and then we'll look at some materials. Making sure that they're easy to read and understand. Remember our 5th to 6th grade reading level. And you can check readability if you have something in Word. If you do the spell check at the end, it'll show you the grade level. The purpose of the material is clear, right? There's no confusing or irrelevant information. Using common everyday language, we've talked about that. Health education materials, flyers, pamphlets, etc., that break information up into chunks are better than something that's just all words all the way down. If someone sees something that's just all words all the way down the page, they're probably going to be overwhelmed, right? Good health education material identifies at least one action item, uses good visual aids, like Maya said, and of course, be aware of confusing numbers because they can be confusing. So what we're going to do now is we're going to show you some examples of different health education materials, and we're going to ask for you to let us know what you think based on what we just kind of reviewed. All right, so the first set of flyers, there's 3. These are 3 COVID-19 vaccination flyers on children. So the one on the left here is from MDHHS. The one on the right is from the CDC, and then the one in the middle is one that Authority Health created. And when you take a look at these 3, and there's no wrong answers, if you want to come off mute and let us know which one of these 3 would be most effective with the members or clients that you work with, and why.
Probably the first one.
This one?
Yes.
Okay, why do you think that?
I think it captures your attention. There are graphics, and then it's straight and to the point.
Okay, so keep up to date with the booster.
Well, no, I want to change my answer.
I mean, you can. This is an open forum. What are you thinking, Keisha?
I'm not going to change it. I wanted to change it at first. So the second one, I just think that it's kind of limited. It gives the idea of just that age range. And so if people don't know enough information about COVID, they may assume or make assumptions, which is common. So I don't know. I'll let someone else chime in too. I think I might stick with the first one for now.
Okay. Does anyone else have any thoughts? Oh, Konisha, if you're talking, you're muted.
I'm sorry. I'm kind of on the fence between the second and the third one. And the reason being is because it states COVID-19 vaccinations or vaccines pretty boldly. So it kind of grabs your attention. The second one is a little bit more short and sweet and to the point. I feel like it states the age, it tells you where to go and the number and the dates and the times, which is, just pretty, straightforward. The third one, and I feel like maybe a little bit wordy, But it does also, you know, boldly state COVID-19 vaccination, and then it says get ready for school. So those two things will kind of grab my attention, but I think I will go more so with 2 because it's short, sweet, and straight to the point.
We appreciate that perspective. Does anyone else have any thoughts? I would say, you know, we've done this for several months, so people typically say 2 is the most direct, right? Like parents, if you see this, you know, kind of what the message is, keep your cubs safe, you know, you can relate to that. But it doesn't mean that that's the right, you know, like they all have different pieces to consider, right? So just keep in mind things that we're looking for, you know, what will work best with your patients or members that you're working with. All right, let's go on to another one. So this was released by MDHHS, and this was about the vaccine. Scientists have taken hundreds of steps to open this door. So we have a picture here, and then we have all these words, you know, developed, decades of research, months of clinical development, scientists, yeah, et cetera, et cetera. Would this work for the patients or clients that you work with? Do you think this would be effective? Why or why not?
I think it could, if I was there to further explain maybe a little bit deeper. Some things that I think that I personally feel like they may not understand. I find myself doing that a lot, even when I'm doing an assessment or, you know, asking questions. I'll ask the question, but then I'll kind of put it in layman's terms a little bit better for them to understand. So I feel like it could be,
Either way?
yeah, either way.
Let me re-ask this. Without you there, would this work if your member just saw this somewhere?
No, I don't think so.
So you-
Clinical
Right.
would be, you know, development, would, you know, I think those are a couple decades that might be, you know, issues. Just a few words that kind of stick out to me, diverse, that I think they might be a little bit hard to understand.
I don't think so because of like the client that we service, a lot of people don't trust scientists, don't trust doctors. So I don't think that this would be effective for the population that we serve, in my opinion.
Yeah. And that's pretty much, you know, Quinny, she brought up a good point. You would have to be there to explain this. There's no way, it's just, it's not, nobody likes this one. Let's keep moving on. Okay, so the next 3 are actually all from MDHHS. And I wanted to bring these up to show, you know, the whole point of clear messaging. This first is the Omicron, you know, recommendation or whatever. You can see there's an asterisk here and there's another asterisk here, and then there's all this tiny print underneath. And anytime you have multiple asterisks, you know, you're going to potentially cause confusion. People might not understand the messages clearly, right? This one, I don't know if anyone else had issues with this. Maya's sick of hearing the story, but I've had, you know, we had, after this came out, again, multiple asterisks, multiple small print underneath. I had, you know, friends calling me saying, you know, my daughter has COVID and she's still sick. She's got a fever, but her boss wants her to come back with a mask. It's day 6. And so again, it was like, no, you have to be asymptomatic or very limited symptoms to come back on day 6. If you have symptoms, that doesn't apply. So, you know, you have to read these small fine print to understand this, but just another example of how messaging can be confusing. Does that make sense? Okay. What do you think about this one? So this was make a COVID-19 plan. We have these pretty, you know, easy to understand large directives, right? Things to do. What do you think about all this small print?
I think small print is easy to get overlooked. We don't want to take the time to read all of that.
Right. Thanks, Aletta. So what if we just took all the small print out and just had the big points? Right, so just something to consider. you know, if you are gonna put something out there, use something, just keep in mind that the small font's gonna get lost in the mix, right? Potentially. So just something to think about. Any other feedback on this? Okay, I'm gonna turn it over to Maya.
Okay. So this flyer was made by MDHHS. And how do we feel about this? So let's just role play just a little bit. Let's pretend that we are a parent in a pediatrician's office with our child, and this is hanging on the wall. So what would be your initial feelings about this? This little cute little baby crying. There's someone in the hospital bed. How do we feel about this flyer?
It wouldn't bother me, but I could imagine some people would probably, I guess, a little scary, a little overwhelming to see.
Sure,
Yeah.
absolutely.
I will
And there's-
also say, sorry, I will
No,
also
I'm sorry.
say if there's like a kid in there, if there's a child or, you know, whatever part of development they're in, and they're looking at that with their parent, or they're just, that can also scare them.
Sure, absolutely, absolutely. And there's a lot of words here. It's a little bit of information overload. It's great, great information, don't get me wrong. But there are some words that may be difficult for some of our population served to understand. Like this one here in this box, vaccinations help prevent multi-symptom inflammatory syndrome. See, I'm having a difficult time. So that may be difficult for our population served to understand. Any more thoughts before we go on to the next one? All right, so we'll keep it going. So how do we feel about this flyer? There's no one in the hospital bed. There's some cute little cartoon graphics. I love this one because the second little girl, she looks like me when I have my hair like that. So I love this one. It's not as scary, but how do we feel about this one? This one's created by the CDC, by the way.
It's
just-
just too much information. Sorry.
Yeah, I was gonna say the same thing. It just seems like it's wordy. Like when I see stuff like that, I instantly don't want to read. I want to, you know, read the things that kind of just get straight to the point, you know, especially if I'm busy or on the go, you know, just a few, you know, bold items that let me know exactly what it's talking about. And then maybe I'll return to it later, you know, when I see the importance of the document.
Sure, sure. Thank you. So any other thoughts on that, on this flyer? So I just want to say the last two flyers have the exact same information. So that's something to think about as well. It's not always what you communicate, but more of how it's communicated and how it's broken up. So thank you so much.
Okay,
So when using health materials, we don't want to assume that your patients can read that material because again, they may come with a different level of literacy. And when reviewing a handout, it's important that you circle or highlight the most important points. Use or personalize the material by adding the patient's name or medication. Use a teach back method, which we'll dive into here shortly. Emphasize the importance of keeping material so they can refer to it with the follow-up with the patient. And make sure a patient has internet access before recommending digital materials. So before we send a patient to a website, we may just want to check in and say, you know, hey, do you have access to the internet, or can you access this from your phone? Okay. Oh, and obtain patients' feedback on materials because of course feedback, I heard this one time at a corporate job that feedback is definitely a gift. So feedback does help us improve and make those materials better.
okay, so we're gonna move on to health literacy strategy number 3, which is teach back. Traditionally, studies have shown that 40 to 80% of the medical information that we tell our patients is forgotten immediately, and half of the what's remembered is incorrect. So it's really important that we employ strategies to increase the amount of information that people remember and in an accurate way. Has anyone learned about TeachPack in the past? All right. You guys know what it is. All right. So it's a way of checking understanding by asking the members or the family members to explain back what you just said, basically. You want to make sure that, you know, you're not trying to quiz your patient or make them feel bad or anything like that. This is just really on us. It's the onus on us that we make sure that we're explaining things clearly. It works. It helps improve patient understanding, adherence to a treatment plan. It decreases callbacks and canceled appointments and can improve patient satisfaction and outcomes. So teach back, a lot of the things that we'll talk about today, and this is usually where I begin this part of this conversation, is something that, takes some practice and some additional learning. So there are several concepts that we'll kind of introduce. If you haven't learned them already, I encourage you to follow up either if you're a community health worker with more modules, or on YouTube. There's so many different things that you can access to learn more. So teach back and communication in general, it's important to use a caring voice, right, an attitude, making sure that you use comfortable body language depending on the person you're with, making appropriate eye contact. And again, we talked about this plain language, asking the patient to explain back using their own words. And again, emphasizing the responsibility is on me, not you. Okay, this is a basic graphic of how teach back works. If you were in with a member and you were talking about multiple things, like let's say if I was a healthcare provider and the member has diabetes and COPD and hypertension, we would say, okay, we're not going to try to teach you your treatment plan for all of that at once. That would be too much. So we're going to chunk it up and teach it in information chunks. Does that make sense? Okay. So we teach the information. We ask them to teach back in their own words. And if they can, that's great. Then they're more likely to remember the information. If they struggle, then it's okay to what you do next is you re-explain, or you use a different way to demonstrate the method, and then, keep going. And then once, the member has shown that they comprehend, then you've done your job, and hopefully they'll have improved outcomes. Okay, so teach back example. So Maya and I are going to do a quick example of a teach back. The next 3 slides, imagine that we're in a clinic together and we're using the next 3 slides as a handout. So you'll see what I mean. So just kind of follow along and imagine I'm showing this handout to her. All right. All right, Ms. Campbell, as you know, your COPD and diabetes put you at a higher risk for developing severe COVID-19. I'm going to prescribe you the antiviral medication called Paxlovid. This is what a dose of Paxlovid looks like. There's 2 pink pills and 1 white pill in each dose. You need to take the whole packet 2 times a day for 5 days. Here's some additional information about taking Paxlovid. I've highlighted the most important instructions, such as taking the pills whole. And here's a list of medications that you can't take if you're using Paxlovid. Are you taking any of these medications, Ms. Campbell?
Yes, I take St. John's wort.
Okay, so we'll want you to avoid that while you're taking Paxlovid. Here are some side effects to look for. The most important thing is liver damage. If you have anything like your skin or eyes turning yellow, or you're getting really itchy, or your urine's dark, please give the office a call right away. Here's some other side effects that I've circled. These are more common, and if they do happen, they will resolve in 3 to 5 days. So I'd like to make sure I've explained everything clearly to you. Can you tell me, how are you going to take Paxlovid and what will you look for?
Yeah, okay. So each pill packet has 3 pills. I need to take 2 packets, or I need to take 1 packet 2 times a day for 5 days. Avoid taking my St. John's wort, and I can't quite remember what side effects to look out for.
Yeah, liver damage is the big thing.
Okay, yeah, that's right. So I'll give you a call if I notice my skin or eyes turning yellow, or if my skin gets real itchy, or if my urine gets dark. I'll make sure to give you a call, doctor.
Thank you. Okay, so that's just a very, kind of general example of teaching her in plain language, asking her to, tell me back what she's going to do. And of course, using the handout so that we can provide it to her into the home. All right, any questions on teach back? It's a quick example. Okay. All right, Health Literacy Strategy 4 isn't really a evidence-based intervention, but it is a project that we did. when we were working, and when I was working at Authority Health with some of the residents, we did a project in a laundromat to improve health literacy. It was a lot of fun. And we came up with this small steps to health after the COVID pandemic hit. And the plan was we had all these posters and cards created to put up in a laundromat and teach about education. So we have 5 different things: high blood pressure, diabetes, eating healthy, physical activity, and stress. And so what we did for small steps to change are basically small step behavior change. And that's the point of this slide. When you're working with your members and you want to set goals, right? We want, for example, to reduce vaccine hesitancy, right? But if we're looking to do behavior change with a member, when we're working with them, it's important to just make sure that we're doing goals, setting goals with them, or they're setting goals that they can attain and achieve. So for example, instead of saying, we say members need 150 minutes a week of cardiac activity, right? 150 minutes of exercise. If you tell your member, if you're sitting in front of them and they say, we need you to exercise 150 minutes a week, they're not going to know where to start, right? That's just too broad of a goal. So, working with your member, perhaps you can come up with something smaller. For example, I had one grandma who said, oh, I love to do dance videos with my granddaughter on YouTube. And I said, well, that is an awesome thing. So that's a small step. Like, rather than saying to someone, increase your water consumption, you need to increase your water. That might not set so well. But if you and the member work together and say, okay, can you do a glass of water every day when you wake up? That's easy to remember, right? You wake up, you drink a glass of water. That might be a small step thing that can induce a bigger change. Maya has a great example of her small step behavior change. So I'll ask you to please share.
Yeah, so I've been on a weight loss journey. It's a continuous journey. But one thing that I do, and what I did when I was really into my weight loss journey, and still, Law and Order is my favorite television show. So in order to treat myself with Law and Order, I would stand in my living room and walk in place through the entire episode. So that's 60 minutes of continuous movement. And I knew it was 60 minutes because the episode of Law and Order is 60 minutes. So it was something small, but it was now this is I've been doing this for so long. Every time I watch Law and Order, if I'm sitting down, I've retrained my brain, oh, I should be walking. That's my treat. And again, it's a small thing. It's only 1 hour. But if we think of over 5 days a week, walking for 1 hour, that's a small step to a big change.
Thanks, Maya. Thanks for sharing. Okay. All right, so that one was quick. We're going to move on to our last intervention, considering language and culture, and I will turn it back over to Maya.
Thank you. So health strategy number 5, considering language and culture. So for us who live or work in Wayne County, we have the absolute pleasure of working in a melting pot where there's lots of different cultures and religious backgrounds and beliefs. So with that, it's important that we know and understand the population that we're serving. So we'll begin with reviewing CLAS, or CLAS. So CLAS is culturally and linguistically appropriate services. And this is a framework to deliver healthcare services. It is a respectful and responsive to the patient's cultural beliefs, preferences, and communication needs. And it does, again, help promote a health equity and reduce health disparities. So some of the CLAS themes, the principal standard, governance and leadership and workforce, communication and language, engagement, continuous improvement, and accountability. All right, so some strategies to implementing CLAS. So some language-related strategies. We want to assess language preferences and language assistance needs. Use acceptable language assistance services. Of course, don't use anything that's unacceptable. Plan for interpreter services in advance. One way I would do this, I would look ahead in the schedule for the week. And if I saw that a patient was coming in that I knew we would need those interpreter services, I would have that information, or I'd have that language line or that interpreter queued up when that patient arrived. Provide written materials in the patient's preferred language. That's also very, very helpful. So some culturally related strategies. Respectfully ask the patient about their health beliefs and customs. Avoid stereotyping based on religious or cultural backgrounds, and address and acknowledge our own implicit bias. All right, so language translation services, the do's and don'ts. So we want to use bilingual clinicians or staff members whose proficiency has been confirmed. We want to also use staff who has been trained as interpreters, on-site medical interpreters, or telephone or video medical interpreter services. We do not want to use clinicians or staff whose training or who are not trained or certified as medical interpreters. This next one is a pretty big one. We do not want to use the patient's family members or friends. I know that this is very common in some of our populations served, where they will have a person join them for appointments, but it does pose a threat or a risk to the patient's privacy. We want to respect that and respect their choice to have qualified interpreters present. This is another big one, minors. Minors should never be used as language interpreters. All right.
Okay, so the U of M Care Guide site, the link is at the bottom of this slide. I encourage you, if you are looking for health information or health education materials, this site has materials written in many languages, and they've also put together materials for almost every medical condition. They've worked really hard on this. Everything is 5th to 6th grade level, whether it's something they found and put into their system or if it's something they created themselves. So if you are looking for information, you can always use this as a resource. This is from MDHHS. Of course, there are COVID-19 vaccination flyers available in different languages, and the website's there if you're interested in those. Cultural competence, we're going to talk about this for a little bit now. So we know that religion, culture, beliefs, etc., can influence how people understand health and how they utilize the healthcare system. So it's important for us as providers to understand that and to have cultural competence. And this relies on the principles of trust, respect for diversity, equity, fairness, and social justice. So kind of the themes we've been talking about throughout. Considering culture can help us to better engage with patients and to make treatment plans more consistent with the values that they have. So there's several different ways that health customs and beliefs, etc., can impact health engagement. So just review of some of those. Health beliefs, in some cultures, people believe that talking about a poor health outcome will cause it to occur. So they may not want to engage at all in anything related to that. For example, mammograms for breast cancer screening. Health customs, in some cultures, family members play a large role. So you may see elders making healthcare decisions. There may be roles of women and men in society, depending on ethnic customs, may determine who makes the decision about treatment. Religious beliefs can impact it. There are some religious faith and spiritual beliefs which may impact how someone uses the healthcare system or, willingness to accept specific treatments. Dietary customs, this is really important. We love to prescribe the DASH diet to anyone with high blood pressure, right? We prescribe these diets, but we have to consider the customs of the person we're talking to. Are they familiar with how to even prepare certain foods that you're trying to, ask them to follow? Maybe it'd be more appropriate to find recipes in what they are already preparing that are more healthy, right? Interpersonal customs, depending on the culture, eye contact, physical touch, body language may or may not be appropriate. So it's important to know who you're working with so that you avoid, any interpersonal customs that are not appropriate. All right, any questions about this? All right, so the next few slides are just big things that go with cultural competency. We don't have a lot of time to go through each one specifically, but I encourage you to follow up if you would like any more information if you need it. We all have unconscious and sometimes conscious bias, right? So we all are raised in different families in different parts of the world with different customs, like we just talked about. And so we develop a worldview based on what we are exposed to as we grow. And sometimes we have bias and we may not even realize it. So it's important to understand that, you know, how we were raised and what we learned when we were growing up doesn't impact our ability to give good care and empathetic care. Has anyone ever seen this book, The Body Keeps the Score? Okay. So The Body Keeps the Score is a great book. I encourage everyone to read it. Who on the call has heard of toxic stress? Marisha, okay. How about adverse childhood experiences? Okay. So we understand, right, how trauma and toxic stress impacts the body and physically, mentally, spiritually, etc. We know that there's a link between adversity in childhood and trauma and the way that your health outcomes, you know, are impacted throughout your life. Toxic stress, for those that aren't familiar with the term, our bodies, right? We have this built-in stress response, right? If a bear comes, we what? We fight or flight, usually, or freeze. And that's good. That's built in to help protect us. But when you have exposure to toxic stress or stress that, you know, you're not able to so stress normally would go up, take care of the bear, comes back down to normal, right? When we have situations where we're stressed and our cortisol levels are elevated constantly because, you know, we're constantly being hit with a stress, our levels don't go back down. And that elevated level of cortisol is really the thing that can, you know, impact our body and our health. And so we bring this up just to, you know, culture, all of this kind of rolls together in considering the person as a whole, right? As a whole, and that has these potential things that we need to look for. Maslow's hierarchy of needs, who recognizes this? Yeah. All right, so we know, you know, there are some basic needs that we need to address, right? And I'm going to have Maya share her story of the pandemic.
Yes, thank you. So certainly during, like, even now, of course, but there's been this push, I would say, over the 3 or 4 years to really engage our population serve in mental health services, which is amazing. I'm definitely an advocate for mental health services. But during kind of the pandemic, it was difficult to explain why a single mom needs love and belonging and to join a self-help group or a support group when she's facing eviction. So in the hierarchy of needs, that bottom row, that food and safety and clothing, those have to be taken care of before we can move up the pyramid. So yes, we want to push for everyone to get to self-actualization, but if I'm homeless, I'm not thinking about that. So that's something to consider when we are working with our population served.
Thank you, Maya.
Mhm.
The pair of ACEs. So this image comes from Dr. Dietz at George Washington. You know, we have the adverse childhood experiences are here, but when we look at this tree, it's rooted in adverse community environments. So this is a reminder of all the system work that we need to do to solve this problem of adversity in childhood. Okay, so creating a trauma-informed space. We're going to take a break right after this slide. I give the lecture to graduate students and about trauma-informed care. This is some of the questions that we talk about during that lecture. So some questions when you're working with your member to ask yourself. Have you considered the trauma this person has experienced? You know, you could change this with culture. Have you considered the culture or the language of this person, right? Are you creating a safe place for this person to share? Do you have any unconscious or conscious bias to consider, or can you even be unbiased in certain situations, right? How does your background, history, et cetera, impact your ability to serve the person? Are your actions making others uncomfortable? Are the words you're using respectful and culturally appropriate? And are you actively listening, or are you just talking? Are you just listening to talk or just talking, right? So these are all pieces that have to come together that you consider when working with your members to create a trauma-informed space. And on that note, we're going to take a little break. Go ahead and pause the recording. Okay, so welcome back. We're going to talk about strategies to overcome vaccine hesitancy. Just a definition real quick, hesitancy is delayed as defined as a delay in acceptance or a refusal of vaccine despite being available. My lips are, anyway, causes of vaccine hesitancy, right? So things that we've been talking about throughout this session: healthcare, socioeconomic inequities, inequalities, lack of effective public health messaging, like we've talked about. We need clear, concise messaging. History of unethical research involving ethnic minority groups, of course, led to mistrust in the healthcare system, right? So that's another problem. Structural racism, social disadvantages and social determinants, right? Something big, the growing spread of disinformation, conspiracy theories, right? Barriers to access, not so much a problem in the United States. We have plenty of vaccine, but certainly in some areas, it may be barriers to access that limits the amount of vaccine. So these are some of the causes. The vaccines, the primary vaccine, remember when it came out, it was a monovalent strain. So mono means one. So it covered the original strain. And originally 1 to 3 doses were received depending on the type. The booster vaccination is the new one, is bivalent. So bi means 2. So it covers the original as well as the Omicron variant, BA4 and 5. And everything that's come since then is a subvariant of those. So there is some coverage still from this booster. So this is not the current recommendations. The CDC has changed the recommendations depending on your age and your health condition. Right now, they're not doing any more monovalent vaccine at all. That's not the primary. Everyone's receiving now the booster as their primary series. And right now, I'm just going to encourage, if you need more information on whether or not someone's, I can't remember the word I was just saying, for the vaccine, just send me an email and I'll let you know, or you can read the CDC guidelines. But basically, at this point, they're recommending 1 booster if you haven't been vaccinated, okay? All right, the CDC did put out this vaccination field guide last year. There's a link in the slides, and they do have some methods that are kind of helpful. 2 that we'll discuss specifically are motivational interviewing and combating misinformation. So I will go ahead and turn it back over to Maya. I'm slipping on my words here.
Thank you. So motivational interviewing. So MI is a guided style of communication that balances good listening with giving advice. It's designed to increase the patient's motivation and likelihood of behavioral health uptake. So it is based on the respectful and curious way of being with people that facilitates a natural process of change while respecting the patient's autonomy. All right. So the spirit of motivational interviewing, and we don't have to, for the sake of time, we don't have to go through each section, but the spirit of motivational interviewing in this chart is on the left side, and the authoritative or kind of the old school way of being with patients is on the right side. So with motivation, it's motivational interviewing, it's a collaboration between the patient and practitioner. And just as we talked about before, the patient is the expert in their situation. And the provider may be the expert on the medical side, but no one can, it's best if we pull that, the patient's motivation out and link the behavioral change to the patient's motivation. So not making the decisions for the patient, but allowing the decisions to be made by the patient, informed decision. So the kind of old school way of thinking is the doctor knows best, the provider knows best, what the provider say is that's what goes. So, thank you. So OARS, or OARS. So it's an acronym for open-ended, affirmations, reflections, and summarize. So on the O end, that's asking questions, open-ended questions. So questions that cannot be answered with yes or no. So these questions are designed specifically to engage in conversation with the patient or client. So affirmations, it's recognizing and reinforcing the success of the patients or the clients. So everyone has strengths. So sometimes a patient may not understand their strengths, but it's just affirming those strengths with the patient, even if the strength is, Mr. Jones, you are very good at following up, or you're very good at picking up your prescription. So pulling those things out. Reflections, mirroring what the patient says. I want to highlight that one from the things here because that is a huge thing. It's letting the patient know that you're listening. And that is one thing that you can also do to help build rapport with the patient. Summarize. So letting the patient again know that you're listening and reflecting, using their own words and saying back what you heard. And this in the summarize section, if there's any information that was poorly communicated or something that was confusing, that's when you can catch it in the summary. Okay. All right. So motivational interviewing strategies to discuss related to COVID. So again, start with an open-ended questions and do not assume the patient's vaccine acceptance. So it's a soft start to a kind of controversial topic. Acknowledge the patient's concerns without judging. So empathy reduces the perception that you're approving or disapproving. We want to make sure that we're not being judgmental because that again will break down the communication and also the rapport with the client. And avoid criticizing the patient's information source. Instead of criticizing the source or criticizing the misinformation or disinformation, just provide factual information because it is very possible that the information source could be a respected person in their community. It could be an elder or a religious leader, and we don't want to criticize that. Okay. So number 4, and it's showing your status or your awareness as a messenger. And this is especially true with our communities of color. We are the boots on the ground, and we are sometimes a representative for certain populations. So it's important that we know and have an awareness of our power as that messenger. And number 5 is linking vaccine acceptance to the patient's hopes and goals. Whenever I think about this, I think about the patients that were saying, I can't catch COVID because my mother has ailing health and I don't want to pass it on to my mother, or I cannot catch COVID because I don't want to pass it to my grandchildren. So again, we use our active listening and then link that to the vaccine information, if that makes sense. Okay.
Okay, so we're going to do an example where Maya and I, again, kind of talk out motivational interviewing. The reason why I'm having so much trouble, I just want to share, is that my 16-year-old son is making a gourmet meal right now, and I don't know why. But if you hear anything in the background, I apologize. So motivational interviewing is another method, right, that you need to practice. You need to, watch, listen, practice. So let's get started. So we're going to do 2 examples of a conversation in a clinic. The first one's going to be the traditional approach, or the doctor knows best, right? And so we hope that you can, kind of see some of the differences between that approach and then the second example, which will be using a motivational interviewing approach. And we're almost done, you guys. Hang in there. Okay, so the first one. Ms. Campbell, it's important to immunize your child. If not, you're putting him in danger. Do you know there's still measles cases out there? This disease could be very dangerous. And what about meningitis? That could be fatal. You should update your child's vaccines as soon as possible. He's already late. We could do that now if you want.
Well, I don't see the urgency, and autism is way worse than measles. There's more problems than solutions with this vaccine. Moreover, it's completely unreasonable to give so many vaccines at once.
Studies have demonstrated that there is no link between autism and measles. The vaccine and the measles vaccine. The vaccine is safe, I assure you. You should be aware of the information you find on the internet. Giving several vaccines at the same time is safe and not associated with more pain. Let's do that now.
Well, I heard something else, and not just from the internet. I do read a lot, and vaccines are not mandatory, so I can do what I want.
Yes, you're right. It's not mandatory, but you're putting him and other children who cannot receive vaccines in danger. The risk of disease is much higher than the risk of vaccines. If I'm taking the time to speak with you about this, it's because it's very important.
That's easy for you to say. Everything is so quick. But what if my son gets autism I'm worried about the risk of the vaccines, but you don't seem to be worried about the health of my child.
Of course I am, and I'm worried about the fact that he could get diseases that we can prevent with vaccines.
Yeah, I don't think we're understanding each other, so let's just talk about this at another time.
Okay, so, I adopted the role of, I'm right, this is what you need to do for your child. And you can see how that led to an opposition, right? Okay, let's do a second time, and then don't wave at me. And then we'll do the motivational interviewing approach this time. All right. Ms. Campbell, what do you think about the advantages of vaccination?
Well, I know that vaccines protect children against diseases that we don't see anymore. My child received all of his first vaccines, but I'm worried that the measles vaccine could cause autism. For other vaccines, I have fewer doubts, but for that specific vaccine, I'm hesitating.
As you said, vaccines have reduced diseases in such an important way that they're now less frequent. That's why you vaccinated your child when he was a baby. If I understand you correctly, with the exception of the measles vaccine, other vaccines seem safe to you?
Yes, I know it's a good idea to prevent those infections, but about the measles, I'm conflicted. I've read a lot of books and articles, and lots of people are worried about the link between the vaccine and autism.
So you find that it's important to protect your child against diseases when the vaccines are safe, but you're worried about what you've heard regarding autism and the measles vaccine. I see that you've
Sure.
done a lot of,
I'm sorry.
you've done a lot of research about the subject. If you agree, I could give you some additional information for studies on measles and autism.
Sure, I want to know exactly what's happening.
In fact, you're right. One study had hypothesized a link between vaccine and autism, but this study was fake and the author lost his medical license. More than 500 additional studies have shown around the world that there's no link between the measles vaccine and autism. The frequency of autism is the same in the vaccinated group of children and in a non-vaccinated group. What do you think?
Well, so I'm not so crazy to be worried about that.
Of course not. You're totally right.
Okay, well, thank you for taking the time to understand my concerns, and I do think it's a bit clearer now.
Okay, so can you see the difference? Which is pretty subtle, but the second time, I started with an open-ended question. I didn't assume that she felt one way or the other, elicited the information, and then we, narrowed it down what her concerns were, and I was able to give her that information that she needed. Okay, so again, motivational interviewing, an excellent way to set goals and whatnot with your members. Okay. Last strategy. Combating mis and disinformation. This is a pretty quick one. Who knows the difference between misinformation and disinformation? Anyone? So misinformation is false information that's shared, but the person who shared it didn't realize it was false. Disinformation is purposefully shared, not correct information, right? So that's the difference. So we have to consider that there's two different things going on. So information in general, where do we access it? This is just a small, snapshot of what's going on in the landscape of social media right now. There are so many different places that people access information, right? So no wonder that we have this problem with conspiracy theories and disinformation and misinformation. So, when you're presented with mis and disinformation, like Maya said earlier, the best thing to do is not to argue, but just to provide the factual information. Using credible sources to demonstrate the facts. We use the CDC, MDHHS as our sources. We have started to see where people are starting to doubt credible sources. That's a whole nother issue. Again, don't argue against things, just try to provide factual information. Trusted messengers, again, those community champions, people that know the community, know the neighborhood, and can spread the message effectively. So accurate information, this is the most recent information on from the CDC website. And, we can still see that if you're unvaccinated, you have a higher risk of contracting COVID-19, of course. So we're still able to see that difference. And then, and the same thing with death by COVID-19. So compared to unvaccinated, vaccinated people have a 5.3 times less likely risk to die from COVID. And this is the data since May 2022 so the past year, you can see. Okay, so that's basically what we can say about information, sharing information. You know, the resource to get the accurate information, you know, we show you what it is, you can share it with your members. And that's probably the most effective thing we can do at this point. So I'll turn it back over to Maya.
So this is another one of our interactive slides. So who can share a situation where someone refused to get vaccinated due to dis or misinformation? How did you react? Was it effective?
Well, for me, initially it was me. I hadn't had the flu shot or been vaccinated, and then it became sort of mandatory during that time period for your job to say, well, you have to, and it didn't go well. I had all these emotions and thoughts. I was afraid. Ironically, I got the flu shot and then I caught COVID immediately. I knew it. I just knew it. And so luckily, actually our CEO was quite like compassionate, and she talked to me, and it was really nice for her to just kind of meet me where I was and kind of answer questions. Nothing was kind of demanding or anything. She left the decisions to me. And then even after all of that, so yeah, it was an emotional time. But then I was able to read more and more information. I made a decision to stop listening to a lot of outside influences that I had been listening to, and just read the information, ask questions. And whoever contacted me from the Department of Health was a wonderful person. They were patient. They called twice again to check on me, answer more questions. So I had a great experience, unfortunately, after catching it. So yeah, it was a time.
Well, thank you so much, Keisha. And I'm sorry, but I'm glad that you got the information. I'm sorry it took you to catch COVID to get that information, but thank you for sharing your experience. And I'm sorry if I mispronounce your name. Is it Nima? With your hand up?
Nina.
No, I'm so sorry.
It's okay. Well, my own experience was when we did vaccine waiver education. You know, a lot of parents were coming to our health department, and you have a lot of patients, a lot of parents that were very confrontational. They were ready to fight or do whatever. So, those ones, so they will come in, they just want the waiver, and, I will, we'll try to, in fact, on one particular occasion, they have, big file and their laptop ready to, get into argument with me. So I just told them, I said, well, we are not here, to have argument or debate, with you, but it's just to provide you with the necessary information, which is what we are supposed to do, and then you can make your own decision. So, that kind of calmed them down, because what I noticed when we were doing that was a lot of them would just come in, or anxious, or, like I would say, ready to really get into argument with you. But once you tell them that, this was my experience, and some of my colleagues too at that time, was you just kind of disarm them, like you tell them, okay, I'm not here to, kind of for us to argue back and forth, or, it's just to provide you, give you the necessary information, you ask your questions, and I will address that question. And then you can, go back and think about it. And then some of them will be like, okay, at the end, they will be like, yeah, I was just delaying, but, kind of now that you explain it better, for me, then, yeah, I have a mind change. Where can I go and get it? I say, well, our clinic is next door and stuff like that. Some of them, will say, okay, they will do, but then there are some that just, they've made up their mind, they just don't want to have anything to do with any education. So under that circumstance, I didn't push it to be just, I said, okay, I'll give them the necessary information and then, and sign their waiver and they will go their merry way. So.
Yes, thank you so much. I love that as an example because even when they decide not to, it's their decision, but they have all the information, so they're making an informed decision. So thank you so much for sharing that.
Awesome, awesome, awesome. Maya and I love teaching this, to hear everyone's, perspectives. I'm running a little bit short, so we're going to skip the case. It's just a short case. And we'll go ahead and get to Maya.
Yes, so the key summaries today, low health literacy is associated with lower health knowledge, poor medication adherence, increased use of ERs as a primary care, and increased mortality rates. All of these things impact the quality of life, and all of these are impacts of low health literacy. So it's important to use those universal precautions like we talked about. Just assume that all patients have low health literacy. And improving individual and community health literacy levels can reduce vaccine hesitancy and increase COVID-19 vaccination rates. All right, so in the final review, recommended grade level for all written materials is 5th and 6th grade. Health literacy strategies can be used to increase a patient's understanding about their health conditions, empower them to take an active role in their health. And those, again, are clear communication, teach back, using linguistically and culturally appropriate materials, motivational interviewing, and combating misinformation.
All right. So this is the end of our session. I'm going to show you a few more slides, but we are so thankful that you've been able to participate with us today. We're going to come right back to this. There's a few more slides. There's an additional training for the CDC, which is pretty helpful. If you'd like to take that, there's a link right here. And again, here are the resources that we reference throughout the material so you can access them. Before we end, if you are available, we'll give you a few more minutes to do the post-session evaluation. That would be great. Maya will put the link in the chat box, or she has, so you can either scan the QR code or go ahead and access that by the link. You'll see on the post-session evaluation, there's a place if you'd like to receive a completion certificate. So Wayne County Community College District is offering CEUs in a certificate of completion. If you'd like to receive that for attending today, they do require that you give them your personal information so they can register you as a student in their continuing education department to award you the certificate. So you'll see in that post-session evaluation, there's a place to provide that information if you would like to receive the certificate. We have a few more minutes, so I want to open it up. I'm going to go ahead and stop sharing. If you haven't accessed the QR code, you can use the link in the chat box. So we'll go ahead and open it up. If anyone has any questions about what was presented, or if you want to discuss anything further, we're available.
I just want to thank everyone for attending today and certainly sharing your perspective and your experiences. That feedback is very important to us. So thank you so much.
Yes, please. Any feedback is appreciated. We continually want to improve this series. Okay. Well, if there aren't any more questions, we're going to go ahead and let me actually stop recording.